In the following video, we will show how arthrodesis is performed on the distal interphalangeal joint using the shark screw transplant. This surgery is performed on a 76-year-old patient. On the X-ray, one can clearly see the severe wear and the large exophytes at the dip joint. A Y-shaped incision is made for unhindered access to the joint. The incision is extended proximally, approximately to 1 centimeter distal to the proximal interphalangeal joint. The dorsal exophytes are then removed following the separation of the collateral ligaments. A 1.2 millimeter double-pointed K-wire is inserted into the trochlea in the exact location where the drill or the shark screw will exit. When drilling the K-wire to the proximal side, ensure that at least a 1.2 centimeter wide bone bridge remains between the K-wire exit and the trochlea. If the bone bridge is too short, it could become too weak after drilling and tapping. Before checking the position of the K-wire on the X-ray machine, roughen the two dip joint surfaces with the tip of the K-wire or a thin drill bit. Next, clamp in the K-wire proximally and drill the K-wire into the shaft of the distal phalanx, repositioning the dip joint. Since a shark screw with a diameter of 3.5 millimeters was used in this case, the core hole is drilled with the blue label drill over the K-wire. Desired drilling depth is checked using the lateral laser markings. The thread can be cut either manually or with the assistance of a drill. Finally, the finished canal is rinsed with saline solution so that the fine bone shavings do not hinder the insertion of the shark screw. When inserting the shark screw, make sure that the two bone fragments are pressed firmly together. The head of the shark screw is removed just above the bone surface with an oscillating saw. Then mill the still slightly protruding transplant back to the level of the surrounding bone surface. Osteosynthesis with the shark screw is extremely stable. The shark screw acts as a bone bridge and guiding structure. It will be transformed into homologous bone within a few months. The shark screw is made exclusively of high-quality cortical bone and can be easily recognized in the post-operative X-ray. Patients are provided with a short cast splint for 2 weeks. For the next 2 weeks, the operated finger should not be used. After 4 weeks, at the earliest, and following an X-ray exam, the operated finger can be used again for careful manual activities.